Hi, everyone. Welcome to today's therapy panel. We've all seen the movies, the TV shows with the therapy office and the couch and the clipboard. Is that what therapy is really like? Where do you find a therapist? How do you pay for therapy? How do you talk about it with your loved ones? Mental health and its treatment has long been stigmatized in our cultures, making seeking services more intimidating and daunting. Today's panelists hope to give you some insight to the process, the types of treatment, and strategies to talk to your support systems. We hope that this exposure and gained understanding will help you feel a little bit more comfortable when seeking help whenever you need it. If you have questions, please share them in the chat and our moderators will get them to our panelists. Just a quick introduction about myself. My name is Nia Lei. I use he, him pronouns. I am a second generation Vietnamese American. I am a licensed clinical social worker based out of Evanston, Illinois. Most of my clinical experience has been with children and families, but I'm transitioning into private practice and focusing on racial identity development and the anxieties that come with that in first and second generation immigrants, as well as transracial adoptees. We have a great set of panelists today from spans the entire continent and Hawaii as well on our panel. So I'll let them introduce themselves so you can see and learn more about their experiences. Rochelle, if you could just start us off by sharing your name and a little bit about your experience and how you identify culturally.
Thanks, Nia. My name is Rochelle Concepcion. I live here in Honolulu, Hawaii, or the land of the Kanaka Maoli. My pronouns are she, her, hers, and identify as a second generation Filipina American. I currently work for the U.S. Army. I work at a major Army medical center here in Honolulu, but I am also a military member. I serve in the Air National Guard as a public health officer. So kind of a few hats. Additionally, I am the president of the Asian American Psychological Association, as well as a clinical member of the Hawaii Psychological Association. So a lot of my work has been in the past 10 plus years with the military, working initially with active duty members of the Navy and the Marine Corps, and now working with the Army, with their active duty members as well as their dependents and retirees. So I get to see a variety of folks in my practice, and it has just been a blessing to get to do the work that I do. So I'm grateful to be here. Thanks, Nia.
Yeah, awesome. Thanks for joining us. Next up, how about you, Reina?
Sure. Thank you, Nia. My name is Reina. My pronouns are she, her, hers, and I identify as a 1.5 generation Chinese American. I'm a social worker based in New York City, and primarily my experience has been working at an outpatient mental health clinic with Chinese American adolescents and young adults and families. But outside of work, I'm really interested in talking with other Asian American mental health clinicians and thinking about how our practice can incorporate anti-racist, anti-oppressive lens in working with our clients. So I'm a part of the New York Coalition for Asian American Mental Health, where we host conversations and spaces for clinicians to connect. So really happy to join the conversation today and get to know everyone. Thank you.
Yeah, thanks, Rainer. Thanks for being here. Next up, Jeffrey.
Thanks, Nia. So my name is Jeffrey Liu. My pronouns are he, him, his. I identify as a second generation Chinese Canadian. For work, I'm a psychiatrist and a psychotherapist, and I practice at McLean Hospital in Belmont, Massachusetts, and I'm an instructor at Harvard Medical School. And I am also on faculty at the Mass General Hospital Cross-Cultural Center for Student Emotional Wellness. So it's a bit of a mouthful, but we call ourselves the CCC-SEW. And that's an organization that's volunteer run. It's a nonprofit that focuses on education, research, and resource creation for Asian students in America. I'm really excited about the work that we do there as well. So it's really exciting to be here on this panel to talk about therapy.
Yeah, thanks for joining us. And last, Sahej.
Hi, yes. So I am Sahej Kohli. My pronouns are she, her. I am based in Washington, D.C. I identify as Indian American, but my parents immigrated from both India and Japan. So even though I'm full South Asian and Indian, my mom's family is from Japan. So I spent a lot of my childhood I like to say I grew up with 3 cultures. So I am also a second-year student at George Washington University studying clinical mental health counseling. So not quite a licensed therapist, but I do work as a counseling intern at the clinic on campus serving the District of Columbia, Maryland, and Virginia area. I also sit on the board for the Maryland Counselors of Social Justice, and I am a National Board of Certified Counselors Minority Fellow. And I am the founder of Brown Girl Therapy, a wellness organization for children of immigrants. And so as a former journalist, I like to say that my passion lies at the intersection of mental health and narrative storytelling. And a lot of the work that I want to be doing is democratizing and decolonizing mental health.
Awesome. Thank you. And thank you all of you for joining. Let's start like big picture on therapy, right? I think when we aren't really familiar, we're not really sure what purposes to go, like what are the, like, when is it appropriate to go? Is there an appropriate time to go to therapy? What are some reasons for someone to go to therapy or seek out therapy? Let's start with Sahej.
Yeah, so there are many different reasons for people to seek out therapy. Psychotherapy can be really helpful for the really big issues, grief, helplessness, mental health illnesses, but it's also a really good outlet for navigating your bicultural identity, for boundary setting, for exploring your generational trauma, for navigating attachment and relationship issues. So I like to say there's not just one reason to go seek a therapist. I know when I went a few years ago, I was seeking it for a very specific reason based off of trauma, but now I go as personal development tool just to be in touch with myself, to have that space and to be able to reflect on my family's experiences and how they may be affecting me.
Yeah. So there's nothing too little or too big, and it's about kind of what you're needing and how you can get help. I know when people think about therapy, they think about mental health, they think about diagnosis, right? How does that play into getting services, and what does that look like in therapy? I think maybe Jeffrey, you could share about this one.
Yeah, totally. Yeah. So it's true that sort of the mental health system is sort of organized from like a financial standpoint around diagnosis, but that does not mean you have to have a diagnosis in order to seek therapy. So you could certainly go for depression or anxiety, but you can also go for like things as broad as like, I don't feel right, or I don't feel fulfilled in my relationships, or I'm having issues with my parents. So it's really broad. And I think if there's something in you that's saying that something's not right and you want something to change, that's a sufficient reason to go seek a therapist, in my opinion.
Yeah, and just kind of to follow up on that, I know with the stigmas with diagnosis, and it kind of people have a fear of getting diagnosed. What does getting a diagnosis mean, and how does that really like inform treatment and inform, like, how does that follow you if it does? Jeffrey, if you could.
Yeah. So I think I guess speaking as a psychiatrist here, the diagnosis for me is helpful because it sort of paves the way for a treatment plan. So, for example, if someone meets criteria for depression, it sees to me, okay, we can try this set of medications, we can employ this set of therapies. So it does help sort of guide the treatment plan and help folks get sort of access to relief as quickly as possible.
Yeah. Raina, do you have anything to add for, I guess, kind of as on the psychotherapist side?
Sure. Yeah, I think the diagnosis from the therapy perspective can be flexible depending on how much the individual wants to address or talk about it or identifies with it. I think sometimes it can be really validating to have a diagnosis to kind of understand like what I'm experiencing is for real a symptom, and it's there's treatments available for it that have been evidence-based and tested. So in that sense, it's positive. And kind of like Jeffrey mentioned, the health insurance system kind of works that way, where if you have a diagnosis, it leads you to be able to get better services. But at the same time, I think there's room if you don't identify with your diagnosis, there's space to talk about that with your therapist and how you feel about that. And I think we often know that people who have experienced trauma, they may be misdiagnosed later on. So that's just a heads up for a lot of us, I think, right, that we can have a diagnosis, but at the same time, there's flexibility if you really want to talk about it and go deeper with your therapist.
Yeah. So diagnosis is not like the end all be all, and it also, for some folks, it gives it takes away the power of what they're feeling because it's normalized and they get vocabulary and the language to describe how they're feeling. And you talked a little, or Jeffrey talked a little bit about how treatment can change, or treatment is different depending on diagnosis. It informs the treatment plan. Rochelle, could you share a little bit about what treatment it looks like? What's the process look like a little bit?
A lot of the time, it really depends on what that person wants to work on. In a lot of different medical or therapy settings, we talk about like functional impacts, right? Not necessarily impairments, but what areas of your life are affected by some of these symptoms that you're experiencing. Are you, you know, not sleeping? Are you not enjoying some of the things that you used to do? Are you, have you noticed any appetite changes? And those types of factors can be things that can be addressed in therapy. If a person isn't ready to go, divulge into some of the deeper issues that accompany like trauma or whatnot. For example, in my practice, I work in a family medicine clinic, and many of the patients that are referred to me, especially patients that identify as people of color, will be initially referred to me for things that are like medically based, weight management, smoking cessation, sleep disturbances. And, at least to start with, those specific things, like I'm not sleeping very well, or, I've noticed I smoke a lot more than I did, years ago, can at least open the door to help folks, feel much better about, going into therapy and talking to somebody who's seen as an expert to address some of these issues. And then it opens up other doors to larger conversations as to the underpinnings of some of these issues.
Yeah, so kind of that kind of gives the whole picture a little bit. What does a therapy session look like, and what can we expect in a therapy session? I know it will range, but I painted that picture from movies and things like that, and I think that's a common stereotype that people just think it's laying on a couch and talking. And I know it can vary. Reno, could you give a little insight on kind of what does it look like inside the therapy room?
Sure, thanks, Nia. I think that we can frame it as it depends on what you're comfortable with and how vulnerable you would like to be. And so, for example, at the beginning, when you're just building the relationship with a therapist, maybe you're not as comfortable sharing entirely everything that you've experienced, or maybe sometimes you are. And so I think what happens in the therapy room really depends on what you're wanting to talk about or explore and how vulnerable you'd like to be. And then from the therapist perspective, though, I think in general, we try to be very listen, I think, very accurately and try to understand what you're going through. And then after that, though, the next step in terms of if you would like a coping strategy, or if you want to kind of just sit in this emotion for a little bit in a safe space, we can kind of do a range of skill building and other types of coping skill building after that. But I think it really depends what you want to work on in therapy. Maybe think about some of your goals or how you would like to feel afterward. If you're looking for someone to kind of challenge some of your beliefs or thoughts about a certain experience, or if you're looking for someone to really just hear you out, it can look different in the therapy. So I think it depends on what stage of therapy you're at, and also your own individual goals and your relationship with your therapist.
So it's very the experience inside the therapy room is very client driven, kind of based on what the needs are and the comfort of the client, and kind of what they need to work on. And you talked a little about goals, and I know, Jeffrey, when we talked last week about goals, I know there's sometimes as high achievers or goal-oriented people, we want to be prepared for a therapy session, or we feel like we have to be ready for it somehow. Can you be prepared for therapy, or are there things that a therapist might want a client to come in with?
Yeah, like, so what to expect in a first session.
Yeah.
So typically the first session, I think for most therapies, involves sort of an intake. So it's a lot of history taking, sort of what your experience was like growing up, sort of what your current situation is. It is sometimes helpful. Some therapists emphasize this more than others, but it is sometimes helpful for the for the person who's seeking therapy to have a sense for what they want to work on. Because for some therapists, I think they'll ask point blank, like, what are your goals? And it can be, it's helpful if you've done some of that reflection up front. I guess just to go back to what Reina was talking about, though, sort of in terms of what to expect in therapy, I think it is helpful to point out that therapists are also, I was trying to think of an analogy. It's like people having different like teaching styles or something. There's a wide variety of therapists that exists. And so that first session could look very different depending on the kind of therapy you sign up for. So, or the kind of therapist you plan to work on. So like a CBT therapist might be sort of focused on what behaviors, what thoughts, what's emotions, whereas like a sort of a more Freudian psychodynamic psychotherapist would say like, you know, what brings you in, and then be sort of silent for the session. So just be prepared that there are sort of different styles out there. And so that's a part of, I guess, finding the match is also finding sort of a match of the therapeutic style that works for you.
Yeah. So there's, depending on the therapist, they might come in with different goals depending on their I guess their theoretical framework is kind of what we call how do we align theoretically. Sahej, could you share a little bit more about the different theories? And I actually saw a question come in that kind of relates, right? From the audience that asked, is there a specific theoretical framework that helps with working with Asian Americans? And I'll after you answer kind of the theories part, I'll open it up to see if anyone has like a theory that they feel they've seen in research that aligns with Asian Americans particularly.
Yeah, I would be happy to hear what other people think, just given that I'm still in school and still learning. But for me personally, with the work that I do with brown girl therapy, I am really informed by narrative therapy and relational cultural therapy. And so narrative therapy really focuses on our stories, the way we tell our stories to ourselves, who informs our stories. So for a lot of Asian Americans, it's our parents, it's the generations before us. So really unpacking that, especially living in the West and unpacking, you know, our relationship with internalized racism and all of that. So I think it's important to me to always be focusing on the story, because we won't know what to impact or what we're giving a lot of stake to in the real estate in our mind if we don't really focus on that. Relational cultural therapy really focuses on culture and relationships and believes that we grow in connection with one another. And I am a strong believer of that. So really focusing on attachment and culture and how identity and culture impacts the way that we're living our life, sharing, you know, telling the stories in our head, and also just relating to the people in our workplace, in our romantic relationships, in our families, and the ways that we show up. So both of those are theories that really have frameworks that I like to use. But I would really love to hear from other people on the panel what they think.
Yeah, we'll open it up then to the other three. What have you seen been connected well with Asian American clients, and is there a right theoretical framework?
I can try. So from my understanding, there's some evidence that suggests that CBT actually might sort of be a nice fit for particularly East Asian folks, because there's a sense that there's, yeah, go ahead.
Can you share what CBT is? And
Yeah. Sorry. Yes, definitely. Yeah. So CBT stands for cognitive behavioral therapy. Basically, it's the idea that your thoughts, by changing your thoughts, you can change your behaviors and your emotions. So there are sort of thoughts that we often think about sort of automatically, like I'm not good enough, or I'm hopeless, or this isn't, nothing turns out right for me. And the thought is, by changing and challenging some of those thoughts, you can challenge the feelings associated with those thoughts. There's some evidence to suggest that CBT might actually be a nice fit, because it's sort of very goal oriented. It's time limited, so it's usually around 10 to 12 sessions, and there's a very clear sense of monitoring progress is an active part of the process. So I think that tends to be more in line with, I think, some of like traditional Eastern medicine conceptions, where you go in, you see the healer, and you feel better. So there is a very active focus, whereas some of the other therapies may be less linear in that regard, like progress is not as obvious. And so that's one perspective.
Yeah. I haven't even considered it in that way, in the steps of CBT, and that's a great way to kind of connect it to the Eastern medicine. Reina or Rochelle, do you have something to add?
Sure. I will just add, I was trained in CBT, and then through my practice, though, I actually found, I think my experience with CBT is a little bit different than the evidence that Jeffrey actually mentioned. So in our community here in Queens, right, I work with a lot of Chinese American immigrant young adults and families, and I think in CBT there's the goal of identifying first your thoughts and your emotions too. And I think identifying our emotions can be really challenging if we didn't grow up in an environment to identify our emotions. So that's the challenge I found with CBT, is it's hard to completely follow the guidelines and to kind of stay with the pace, because it's just uncomfortable to talk about emotions at that time. And so my personal perspective is, I think with any of these theories, as long as your therapist is willing to kind of adjust it or be flexible and tailor that therapy to what your experiences are and what you're comfortable with, I think that's probably going to be effective. And I think there is some evidence that suggests about 40% of the outcome of therapy is based on your relationship with your therapist, not based on what approach they're using, or CBT or DBT. So I think, yeah, if you have a therapist who's willing to hear you and your experiences and adjust their practice a little bit to fit with you, I think that'll work. Yeah.
I agree across the board. I mean, when I think about how Jeffrey talked about like CBT or cognitive behavioral therapy and how it's been beneficial when you see there's a goal, there's an objective, and as you see you're making your way towards the goal, you kind of like see that there's progress there. And I know for a lot of our cultures it's good to see that there's progress being made. But then on the other hand, I know as Sahej and Reina were speaking, I was reflecting on something that was mentioned this morning at the social cultural panel. Dr. Celestial talked about meeting the patients where they're at linguistically and culturally, right? And that's a big framework of like relational cultural theory, but then also narrative therapy, being willing to hear the patient. And sometimes especially for myself as a cognitive behavioral therapist, I have to step back from those defined objectives and goals and pause and listen to what they have to say and make adjustments accordingly, because I know it's important to the patient. And especially going back to what Reina said, the relationship is the most important thing when you're working with somebody, and just feeling heard and feeling validated for some of the things that you're presenting in the therapy session.
Yeah. I think that's a great reminder, Reina, about the relationship, because I think, especially coming into it not knowing, you want to feel like you're doing the right thing, or this is the perfect way to feel better, and we get too tied in on like the right modalities, the right system, the right goals. Can you share a little bit more about relationships and what makes a good therapist? What makes a good fit?
Yeah, I think there's a lot of factors. I think I'm speaking from my own experience too. As I was seeking therapy, I had the same expectations. Like I went in the first session, asked the therapist, do you do CBT or do you do other things? And she kind of like explained to me like, oh, I feel like you have some concerns and you might not trust me. And so she kind of pointed out like that was my own anxiety coming into my first therapy session too. And so I think, yeah, the relationship is important, and it's important to talk about those uncomfortable things with your therapist. If they feel like something is uncomfortable, or if you feel like it's something that was said that made you uncomfortable or it wasn't right, I think that's something to really bring up. I think you can go very directly and ask your therapist too. Like if I want to talk about my experience with my family and my experience growing up in China, like is that something I could talk about in therapy? Is that something, do you have experience working with immigrant clients? Your therapist doesn't have to match all of your experiences in terms of ethnic identity or gender or sexual identity, but sometimes I think clients prefer a little bit of similarity to relate. And at the same time, though, I don't think necessarily you have to look for exactly the same identities that you share. Yeah.
Okay. So part of it's identity, part of it is connection, part of it's they're feeling safe and trust with them. And if one of those things aren't present and we don't feel like that's a good fit, what can clients do? What can people do when they don't feel that connection to their therapist or they don't feel safe or comfortable? I'll give this one to Rochelle.
Well, definitely patients or clients have the ability to, you know, ask to terminate therapy, especially if it doesn't feel like the therapist is validating their concerns or, is understanding their story. And I know a lot of the time within our communities, we feel a little ashamed if we have to, tell somebody, I'm sorry, you're not a good fit for me. I'm sorry, I technically have to fire you. But, at the same time, you have to reflect on like what's safe for you and what's impeding your progress if your therapist is not meeting you where you're at. So definitely look into finding somebody who fits your needs and can meet you where you're at.
Mm-hmm. Um,
Can I just
yeah,
jump on Rochelle's answer there too? So I think in addition, I think there's the question of fit, like how is this person going to fit with me? But I think there are sort of across the board, just because this is a therapy 101 panel, I think there are red flags that one should watch out for that this therapist is not good. So the things that I think about is looking for someone who's licensed, so someone who has been trained to do what they're doing. So that's always helpful. Number two, someone who's reliable. So if they're canceling sort of last minute, or they're showing up late consistently, or they're not returning your calls, that's also a red flag for me. I think it's so hard to feel safe and trusting if someone is not going to show up. And then finally, boundaries. This is maybe a little bit of jargony, but basically you want a therapist who knows that the space is for you and not for them. And so if the therapist is talking about their own politics or details of their own life such that you can't get in word in edgewise, or you feel like you're having to take care of the therapist, that's also a red flag for me. So I think those three things across the board to me are things that sort of buyer beware kind of things.
yeah.
I would love to add also, if it's okay.
Yeah,
Just
of course.
given what everyone said, what I hear from a lot of people in the brown girl therapy community is this idea that if you go to therapy, then you're trusting the therapist, and they are, in a place of power, which yes, there is obviously a dynamic, but you should be seeing a therapist who is fighting against that dynamic and meeting you where you are and you're in control. But I think for a lot of Asian Americans, it's hard for us to really remind ourselves of that. So something that I have found really useful is just reminding yourself that this is like a transaction. You're literally paying someone to provide a service for you. And so if that service is not being met, then it's okay for you to leave and take your money elsewhere. And a lot of times you will find that therapists have referrals, will be able to help you with that process. I know we're going to talk about also where you can find a therapist, but I think changing that, just like using that language to think about finding a therapist and thinking of it transactionally in the beginning can be really helpful to giving yourself permission to say like, hey, this isn't working for me anymore.
Yeah. I'm kind of speaking to that power dynamic, right? Sometimes you are in a relationship with them for maybe 3-6 months and they do say something or they do make you feel a certain way. How would you recommend like confronting, how do you have that conversation with your therapist? How about Raina, if you'd like to share?
Sure. I think if you're comfortable, you can directly talk about it with your therapist. You can say, like, last session, you said this when I said this, and I don't think we really understood each other, or you didn't understand me. I didn't feel heard. And then if it keeps coming up, it's kind of a red flag that you're not being heard. So kind of like Sahaj was saying, like therapy should be empowering, right? It should make you feel like you're the person driving forward either your experiences or your process of therapy. And so if you're not feeling empowered, you can bring that up. Or if you don't feel comfortable bringing that up, maybe go to the clinic secretary or manager or supervisor and you can request a transfer. So I think as the client, you do have some power and you can feel brave enough and valuable enough to really use that power and seek what you're looking for.
Jeffrey, you talked a little bit about licensure, right? One of the questions that came in was, there's all these acronyms for different license. Could you share a little bit about what they mean and are they different? And yeah.
Totally, and I'm probably not going to get all of them because there's sort of a burgeoning number, and I think so. I guess I'll start the list. But so the first ones that come to mind. So PhD, PsyD are psychologists. So that's and so PhD, PsyD psychologists, they can be trained to give therapy. Social workers, so LICSWs, LMHCs. I'm probably missing. Yes, actually, you can speak to that.
LCSWs, LMSWs, and then LICWs is the yeah, for social work.
Yes. For prescribers, that's the one I'm most familiar with. So MDs, nurse practitioners, so APRNs, and physician assistants can prescribe medications.
And does anyone else want to add any other acronyms?
Yeah,
I would say we all range in terms of our
I think so,
licensure levels, right? Because Nia and Reina are LCSWs or LCSWs, right? Jeffrey is an MD. I'm a PsyD, so I have a psychology license, and then Sahej is LMHC.
It'll be, it depends on the state, but it's either a clinical mental health counselor or a licensed professional counselor. So very similar to social work or marriage and family therapy, but yeah, there's no prescribing medication, but we can diagnose, do assessments, and provide therapy.
Right.
Yeah. Would you I guess, Sahaj, if you would like to kind of continue, is there a difference? Should you be looking for a specific type of licensure? Are their approaches different?
You know, I generally am of the mindset that no, you don't. As long as they have been licensed, they've gone through the training, they have been, different types of modalities also require different certificates and certifications and trainings and specialties in that way. So I think, using the internet to go to their website to really understand what's behind their name, asking them in the consultation about their education and training, then it wouldn't matter what degree they have. I think if you feel more comfortable, I know people have had friends who have had only really good experiences with social workers, so then they feel inclined to only see a social worker. That's a different story. But generally, we can all do really important work. The difference being, like Jeffrey said, that if you have gotten your doctorate, so the extensiveness of your training and the specialty of it, or if you're a doctor and you can prescribe.
I wanted to add, some clinical psychologists can actually prescribe if they have the extensive training in clinical psychopharmacology. So right now, like in the military, there are psychologists who can prescribe medications if a psychiatrist or a primary care physician isn't available to. And then also in some of our rural community mental health settings, they have employed psychologists who have the ability to prescribe, psychotropic medications.
Oh, sorry, Nia.
Reina, did you want to add something? I saw you unmute.
I just wanted to add a couple of other notes too. I think art therapists and music therapists can also be really helpful, and they have their own licensure. But the important thing is there's a license in art therapy, and then also some therapists might incorporate art or music into therapy, which is kind of different though in the way that we're trained. So I think that's an important question to ask as well, if you're licensed in music or art therapy. The other thing is for certain struggles or challenges, for example, like eating disorders, you might want to be very particular about asking the therapist if they have training in eating disorders or trauma-based therapies, because those, I think, are, you really should have someone who has more experience. Compared to like general anxiety, for example, more therapists might be prepared to work with you. So maybe don't feel surprised if you hear that from a therapist saying maybe it's not quite the right fit because they're concerned that you should have someone who really specializes in what you're experiencing.
That was actually the next question. Is there, if you want to just continue, are there reasons why a therapist would, like, if after the consultation the therapist says like they can't give you services, why they think they're not a good fit? Are there reasons for that? And could you kind of elaborate, Reina?
Yeah, I think this one, maybe I want to reach out and open it up to everyone too. So I think the reasons that I was just speaking of, like if I didn't feel really competent in treating a client with eating disorders, we try to refer them out, and particularly maybe also refer to a nutritionist and general practitioner too, to make sure you're getting a holistic treatment team. But I would want to open it up to everyone else to see if what your experiences are too.
Yeah.
Well, I was looking at the questions from the audience, and somebody had brought up, you know, a question about transference and countertransference. And I know that's a really difficult topic to speak about because, you know, when you have to end therapy because, you know, somebody triggers you or somebody reminds you of something, because it could be a balance of, you know, working through somebody who triggers you and continuing to do that work, you know, might be more beneficial. Whereas if it's a really harmful trigger, you know, that could be a sign that the therapy is not working or the therapist is not kind of working well, you know, with
Yeah.
your values and whatnot. So, you
Could
know,
you
there are
just
issues like that.
could you just share real quickly what does that mean? Countertransference and transference.
So countertransference is a phenomenon where, you know, somebody is like, I don't know, a reminder of somebody from either your past who you are kind of seeing as that person. And so you begin to interact with that person as if they are, you know, that particular person in your past that was, you know, that might have started the trauma or treated you negatively or whatnot. So
Yeah.
I'm not sure if I'm describing that like as
Mhm.
accurately as possible, but you're kind of seeing your therapist or the person that you're interacting with as somebody in your past who had, you know, affected you negatively in some way.
Mhm. Yeah. And Jeffrey or Sahaj, would you want to add anything to why a therapist might not be a good fit for someone?
I think for me personally, Raina hit it on the nose. I know that there are, certain specialties that if a therapist isn't competent, you would want them not to refer you out to someone else. That is in your best interest at that point. So that's not a rejection of any kind. I also, think that if you're starting to work with someone, like if I was working with an individual and then they only want couples or family counseling from there, we might have already seen each other as individuals. So I wouldn't want to take them on as a couple necessarily because I've already had this relationship with one of the clients in an individual setting. So I might refer them out, my client and their partner out to a couples therapist. So there are different reasons just to maintain confidentiality, to maintain professional boundaries, and to maintain, the best services for the client that we would refer out.
Yeah. Thank you. Jeffrey, did you want to add anything in this for this one?
No, I think everyone said it. Yeah, that's great.
And for some clients seeking services, they have a limited list, right? Because they need to use insurance or they can only go to someone with a sliding scale, things like that. What are the different types of ways to access services? And then what would you recommend for someone that is low income and it would be a tough burden to add on to their other budgeting needs? I'll give this one to Sahej to start us off.
Yeah, so there are different avenues for finding a therapist. We have the general databases online like Psychology Today and Open Path Collective. Social media, there's lots of platforms creating very specific databases for specific issues or identities or races. And so those can always be really beneficial. I work at a graduate school. I'm in the clinic there, so I know that our services are really, really accessible. And inexpensive. I also think calling your insurance, if you have it, they can usually send you a list of providers. If you're struggling with payment, some of the things that you can do is group counseling. Group counseling tends to be a lot more accessible and inexpensive, and you would be working, if you can find like an identity affinity group or a group based off of the issue that you want to work on or the struggle that you're having, then you're working alongside other people who are sharing in that struggle, which can be really helpful. I also think, I when social media is used appropriately, it is absolutely not a replacement for therapy. I want to make that very clear. But if you are struggling to get the help that you need, there are ways to find ways to work on coping skills and build your own toolkit on your own, if that's what it comes down to.
Yeah. I think there's great alternatives, not alternatives, but things that you can do on your own to work your way up, work on your own coping, work on your own skill development, and coping. Sorry. And so we're going to shift a little bit to kind of like the stigma and how to support, get support, and then from our loved ones. So stigma, we know it's heavy and it's alive still in our cultures, and that prevents us from being able to talk openly and freely with our families and sometimes even our friends about our mental health, and then also get how we're seeking out support. I think one element is also medication. So I think Jeffrey, we'll start with you for this question. How would you talk to your family about therapy, about needing to seek out therapy, and then more specifically about medication?
Yeah, so I guess just to start about, I guess, generally seeing a therapist and how to talk to your parents about it, I guess the first question I would ask myself is, how much do my parents need to know? Because it would be different if they, I'm on their insurance and I need their insurance to help me pay for therapy. But if they aren't, if I'm on my own insurance, I don't know. I would not delay seeking healthcare in order to have a conversation that's going to be really. I think it's important to prioritize one's own needs in this regard first, before then having the family's approval on it. With that said, I know it's really important. So I guess I think my first piece of advice would be to sort of like I think people have a conception that that the first conversation has to be like sort of a sit down at the dinner table, everyone's there, and then you have to sort of come out with this mental health issue. I would prefer if that's, you send like a New York Times article about like mental health and see like how your parents respond to that, or sort of another way to think about it is to like recruit an ally or something in your family, like someone who's gonna understand, who's gonna take the conversation well, and then who's gonna sort of advocate with you. And then the last thing is like, if you have to, if you want to communicate everything you need to, not necessarily having it in person, but writing a letter or anything to sort of help you with that conversation. Because again, speaking as a healthcare professional and a therapist, getting to therapy as quickly as possible, I think, is the most important thing. So I guess that's how I'd approach sort of getting family on board. As for medications, what I tell folks and family is that medications are tools. They're not like they're not sort of, they don't mean anything about a weakness of character. They're sort of like almost like, I liken them almost to like antibiotics or something. If someone has a pneumonia, antibiotics are a way to sort of help people get back on their feet as quickly as possible. And I think of medications in a lot of the same way. If you come to me as a psychiatrist, I may not prescribe a medication. I may say that actually I think it's probably best dealt with in therapy. But if I think it's helpful, I sort of think about it as a tool on the pathway to recovery.
Okay. Would anyone else like to kind of add a little bit about conversations that they've had with clients about speaking to their families, or even your own experience, Sahej?
Yeah, I would love to. I think Jeffrey, hit the nail on the head with talking about normalizing it in other ways rather than thinking of it as this big conversation you have to have. It helped me in the beginning when I needed therapy to kind of watch a movie that had mental health or therapy as like a storyline, and then have with my parents and have a conversation about it. I also know for some folks, if your parents are really science minded, bringing in research, having a conversation with your parents. If your mom is saying, she's feeling a certain way, just in passing, you can point out, I feel that way all the time, and that's why I'm in therapy. Like, really make it something that they can understand and relate to. And, just by expanding our own emotions and feelings vocabulary and affirming what our parents might be feeling, and then, making it more relatable to them, we can sometimes be able to bridge that gap where then we can kind of explain to them why therapy or medication is really important for us.
Oh.
I was going to add, or actually I would just piggyback off of but both what Jeffrey and Sahej said. I've had conversations with patients who are really resistant to engaging in therapy, to where, because I'm in a primary care clinic or family medicine clinic, I've utilized the analogy of, well, you went to your primary care doctor because you had issues with your knee, and your doctor is, an expert on, just like joints and muscles and bones. So it would be a same like situation with coming to me and talking about like, how do you manage like your emotions, or what are ways to cope when you're feeling stressed out or depressed. So it's been kind of like a combination of talking about like research, but then also just the analogy of going to an expert for something. You wouldn't go to your mechanic if you have the flu. You wouldn't go to like your mechanic if you had like a broken bone or something like that. So just a way to kind of normalize it. And with having the role of getting warm handoffs from your primary care doctor, it's kind of made that conversation a little easier. But I know in other settings it's difficult to kind of talk about like what makes it normal. But having conversations with like family members, especially as Jeffrey pointed out, like somebody who could be like a partner, or like somebody who could kind of advocate for you, in the family, is helpful.
Mm-hmm.
Yeah, I really appreciate everyone's emphasis on like taking it gradually. And I also think if you are going to plan a conversation, I think in advance, right? Plan for who is going to be there to support you after you have the conversation. So you're going to talk to your parents on Sunday. This friend is free on Sunday afternoon, that maybe you told them in advance. You might reach out if you need additional support, or maybe like you tell your therapist in advance, like I'm talking to them on Sunday, I see you on Monday. So there's sort of, that support is going to be there for you, regardless of how the conversation goes.
That's a great idea. And remembering that your therapist is also a partner in this. And they can help you with tools. They can even role play with you if that's something that you like doing. And I know, Jeffrey, when we talked last week, you talked about like also speaking to their values, right? Your parents' values. Could you share a little bit about that?
Yeah, I guess more or less sort of in line with what Sahej was saying, but sort of like, your parents pretty well at this point, and you know what kinds of things they like to hear and what they don't like to hear. So sort of pre-packaging your message in some ways to appeal to their values. So like, if my parents are sort of very academically minded, sort of saying like, going to therapy will allow me to do better in school, and sort of appealing to that. Can help the conversation potentially go a little smoother.
Yeah, and sometimes our loved ones only see our behaviors, right? They don't never actually see what we feel, and so talking about, oh, it's going to help me sleep better or help me study more, eat more, can help them kind of see how that would impact you. Question that came in is, sometimes we're not going to get support from our families or our support systems. How does that impact treatment? And does it impact treatment? I think we can start with Reina for this one.
Yeah, I think we can acknowledge, right, that it's a really difficult situation to be in, and it's really hard. And I think giving yourself enough credit that you're going to therapy already in itself is a lot that you're doing for yourself. So if you feel like there's lack of support in your networks, right, but you're doing this for yourself, you're coming to therapy weekly or however often you go, it's really trying to support yourself and make it through this time. And maybe through therapy, you might find other ways to connect with others or feel nourished in some other ways.
Yeah. I feel like there's open that one up to everyone else, kind of what you feel about that as well, Saj.
Yeah, I mean, I think Reina, is right that it's a very difficult situation to be in. But like Jeffrey also said earlier, I would never want that to be the reason why someone doesn't access the help or the care. So, to his first point in the last question, which is like, how much do my parents really need to know right now, is an essential one. I think especially for children of immigrants and Asian Americans, it can be really hard for us to take steps without our parents' acknowledgement or support, but I want to acknowledge that that's still a really important thing to navigate and to do for yourself. I also think there are other ways to find that support, right? So through friendships, through, like social media channels. So at Brown Girl Therapy, we do a lot of peer support groups, and these are communities where people can relate to each other and talk to each other and feel less alone, especially now during the pandemic, when if you are living at home and are not getting that support, it is really important to find that support elsewhere, even if it's virtually. So that would be my 2 cents for how to replace that support in a way that you possibly can to still feel like you're being nurtured elsewhere.
Mm-hmm. Anything you'd like to add, Rochelle or Jeffrey?
All I thought of when Sahej was talking was find your tribe, right? There's so many different outlets for you to find, the people that can support you, even if it's not, the people that you expect, right? It wouldn't be your family members, or it wouldn't be like your parents, but you can find other people who can empathize or, be on that journey along with you as, you're doing the work.
Yeah. So we're getting right to time here. Thanks for all that you've all been sharing. For each of you, if you could say 1 to 2 sentences that you'd like everyone in the attendance to take away about therapy, about mental health, what would you want them to take away from today?
I can go first. So I think for Asian Americans, especially, or people of color generally, it can be hard to feel like you deserve quality care when the care doesn't look like you or doesn't speak to your cultural norms or literally speak your language. There are so many things I could add there, but I just want to remind you all that you do deserve quality care. You do deserve care. It is out there. Sometimes there's a little bit of digging that needs to happen, trial and error, and finding, having those consultations and finding the right fit. But when you do find it, it really can be a life-changing experience, and we all deserve that.
Yeah, I'll piggyback of Sahej and sort of reiterate her last line there, which is therapy can change lives. It can be incredible, and I would want that for everyone.
Yeah. Raina or Rochelle?
I think it's hard for me to summarize in a few sentences, but I think because this conference is hosted by Asian Mental Health Collective, right, I think there's the idea of community, and that's really important as Asian Americans. But also on the other hand, even though if we might identify as Asian American, but we all have different and unique experiences. So I think understanding that balance is really important. Like I think there's a lot of benefits to this community, and at the same time, I think it's really valuable to take time for yourself and understand how you might feel different or be unique from other Asian Americans, and honor that and value that, and you can love yourself for that.
Thank you.
Okay, so to piggyback off of what Raina said, I mean, we think about our communities as being very collectivistic. We take care of each other. And so an analogy that, we often hear, whether it be in the therapy room or even something that I've used with patients is, you put on your oxygen mask first so you can care for others. So, and I know it's something that other therapists before me have used as an analogy, but think about that when you're kind of at the crossroads, when you're trying to think about whether you should pursue therapy or not. You want to be in the best position possible so you can provide that care for other people, no matter who they are. So,
yeah, sometimes you have to remind yourself that self-care is community care, right? So thank you, panelists, for taking the time and sharing some of your knowledges and experience today. Thank you, attendees, for tuning in. Thank you for the Asian Mental Health Collective for this panel and for this event and for letting me be a part of it. Seeking help is difficult and can even feel wrong from the years of internalized stigma. We hope that the information shared today eases some worries and helps open the door for you all to seeking mental health services if you feel the need to. We as a generation can be the ones to begin to break the cycles of stigma and normalize mental health treatment in our communities and in our families. Thank you all, and enjoy the rest of the conference.